Hi everyone, my name is Elisa Martinez, and today I'll be talking about something really interesting and personal to me. In my presentation, I'll be going over a recent research study that compared PFO closures, which is a procedure to seal a hole in the heart, versus medical therapy to prevent another stroke. I'll explain how the research was done, what they found, and what the next steps are for future studies. So I will explain why was this topic important to me and why I picked this study. So during the first week of school, my boyfriend suffered a stroke while at work. It was really interesting because, of course, he is a lot younger than someone who you would figure to have a stroke. This was my first time hearing the term PFO, and then of course I looked into different treatments to this issue, just going along through the journey with him, and it's kind of crazy how it all tied into physiology as well. First, let me go ahead and go over what is a PFO. A PFO stands for a patent foramen ovale, which is a hole between the left and the right atria. Everyone has this hole before birth, and it usually closes up after birth. This occurs in about 1 in 4 people. Most people never know they have it, and then the PFO may allow clots to bypass the lungs and trigger strokes in patients. This research was conducted by Dr. Amr Hamad and his team at Columbia University's Department of Cardiology in New York. Their study was published in the Cardiovascular Review in June 2025, and it analyzed multiple clinical trials that compared PFO closure procedures to medical therapy for preventing another stroke. I chose this study because it's one of the most recent and comprehensive analysis on this topic. So, the purpose of the study was to find out whether closing a PFO is more effective than using medication alone to prevent another stroke in people who have already had one. Researchers also wanted to see what the long-term outcomes were. For example, whether PFO closure reduced stroke risk, improved survival, or caused new complications such as irregular heart rhythms. Basically, the goal was to figure out which treatment is safer and more effective for patients with a PFO after a stroke. The study itself pulled data from 32 studies, including 6 randomized controlled trials and 26 observational studies covering 16,698 patients. To do this study, researchers looked at data from 32 different studies, including both clinical trials and real-world patient studies, with more than 16,000 people who had a PFO and a previous stroke. They compared 2 main treatments. One group of patients had their PFO closed with a small device during a procedure, and the other group was treated with medication like blood thinners or aspirin to prevent clots. The researchers then looked at which group had better outcomes, mainly how many people had another stroke, if there were any deaths, or if new heart rhythm problems like atrial fibrillation developed. As you can see, I gave 3 examples. I have the RESPECT trial, the CLOSER trial, and a PC trial. Each device and intervention used, the medical therapy, and then, of course, some notes on the little studies that they did. So, the summary of results. Researchers found that people who had their PFO closed had fewer strokes compared to people who were only treated with medication. When they compared the 2 groups, closing the PFO reduced the risk of another stroke by almost half. It also lowered the chance of dying from any cause, but there was a trade-off. People who got the PFO closure had a higher risk of developing atrial fibrillation, which is an irregular heart rhythm. So, while closing the PFO helps prevent strokes, it can sometimes cause heart rhythm problems. Overall, the results show that for many patients, especially younger ones, who had a stroke for no clear reason, closing the PFO seems to be the better option. So, the next steps for research. Even though these studies show that closing a PFO can help prevent strokes, researchers still want to learn more. They want to follow patients for a longer time to make sure that the benefits last and to see if there are any long-term side effects. Another goal is to figure out which patients benefit the most, since not everyone with a PFO needs it closed. They're also trying to improve the procedure to make it safer and reduce the chances of getting atrial fibrillation afterward. Finally, most studies focus on people under 60, so researchers want to see how this treatment works for older adults as well. So overall, I found this topic super meaningful because my boyfriend went through this experience, getting to learn the physiology behind it, and then of course the research being done to improve outcomes made me realize how much science can help shape future treatments. So on that note, he is getting a PFO closure, and then on top of that, just to let you guys know, he is okay. It's honestly surprising that he didn't have long-term effects. Even doctors are like, wow, I would look at you and not know you guys had a stroke. So thankfully he didn't suffer anything too crazy. But thank you guys for listening. Go ahead and ask any questions about the research being done on this. Thanks.